Could you start by outlining the main elements of the new labour market reforms?
The key elements phased in from about 2002, 2003, first of all, to make NHS hospitals more autonomous, so-called foundation trusts. Secondly, to enable those hospitals to be paid for what they produced, for their outputs. That's so-called payment by results, which was really activity-based funding. Related to that, the evolution over time of an offer of patient choice of place of care, mostly for elective care, and that the whole package really together encouraging competition by bringing in new providers of care, particularly from the private and third sector.
And how did the market under New Labour differ from the internal market under the previous Conservative government during the 1990s?
Well, it was very similar, since the focus was largely on trying to get suppliers of services to compete to varying degrees. But I'd say that the incentives towards quality and efficiency were much stronger, so the scope for competition was greater. And I suppose one of the big innovations that New Labour was quite proud of was payment by result.
And would you say that under Labour there was greater diversity in provision than was ever achieved in the 1990s?
Yes, I mean the 1990s market, the word internal I think sums it up, was really focused on getting NHS or publicly owned providers to compete a bit more. Whereas New Labour wanted to do two things. It wanted to increase the level of competition by introducing new providers, but it also wanted to grow the capacity of the NHS. So for that reason, there was another incentive for them to involve non-public, third sector and for-profit private sector providers.
And as I understand it, the New Labour government had invested a lot of money and resources in trying to get the NHS to improve its performance, but were getting increasingly frustrated that it wasn't improving, or at least not as quickly as they hoped. What do you think the main challenges were that the reforms were designed to address?
Yes, there was a sense of a worry that resources were being put in, that this massive increase in spending, unprecedented. There was increased capacity, more staff. And there'd been a period also before then of using targets and strong performance management to drive improvements, particularly to reduce waiting times. And those things had been successful, but there was a fear that this required strong intervention from the Department of Health and indeed from Downing Street itself, and that couldn't be sustained. And of course, naturally, given the sort of ideological bent of New Labour, markets were seen as a way of generating that sort of continuous pressure for improvement.
And they were improvements in quality, efficiency, how responsive the service was to patients?
Yes, I suppose they felt that there'd been improvements in things like waiting times, and perhaps the main focus and the main rationale for PBR was let's have more competition focused on quality, particularly in improving outcomes.
If those were the objectives, did they achieve those objectives in your opinion?
I think pulling the evidence together in the book with you, I think we can say that to a surprising extent the proponents of change have been to some extent vindicated, that by and large this did supplement and contribute in a modest way to continuing the improvement in performance.
So the coalition government are pursuing a further set of reforms. To some extent they continue with the market. The main critics of the reforms are saying it's all about competition. How do you think the coalition government's proposals differ from the New Labour market reforms?
Well, intellectually they're a continuation. They're dressed up slightly differently. Perhaps the ambition is even greater, so to widen the scope of competition to potentially all NHS services, not just the more packageable, marketable elective services.
The impact has been quite modest, the size of the effect. So why do you think that is, and should the critics be silenced?
The changes in the legislation that the coalition are trying to bring in, it is argued by critics, essentially turn the NHS into a business like any other. My answer to some of this criticism is to say, look at the way the politics runs. Don't worry too much about the detail of the legislation. What matters in the NHS is how it plays out politically, how it plays out with patient groups, with professionals.
The coalition government reforms are being implemented in a completely different financial context from the ones that we looked at in the book under New Labour.
The budget is declining in real terms and will continue to do for at least 3, 4, 5 years. In that environment, I suspect that competition is going to be much tougher. I think if the government is expecting pro-competitive policies to deliver all the performance and productivity gains they're wishing for, I think that's most unlikely.
Share one lesson from our review of the evidence of New Labour's market reforms of the NHS with the current Secretary of State. What would you tell Mr Lansley?
I would certainly tell him not to put all his eggs in the competition patient choice basket. I think he has to realise, quite apart from the current political opposition that he's stirred up, that let's assume he gets through that and somehow a bill is passed into law and he gets his pro-competitive package. I think he has to recognise that just as his predecessors tried to pull every available lever, sometimes to the despair of the more sort of purist advisors that they had, that actually I think the English NHS responds to a variety of different ways of coercing, bribing, incentivising, encouraging and flattering to improve performance.
So thanks very much, Nick.
Pleasure.